All right. Good morning, everybody. We're going to talk about job searching this morning. So, if you all want to interrupt and ask questions, you're more than welcome to. I shared these slides for you all so that you can go back and reference whichever portion is more important for you. There's some different lists of like questions to consider and topics to consider and things like that. So, hopefully, it'll be something that'll be helpful for you as you progress, either with this job search or, in the future, if you decide to change jobs, things like that. When you either begin or continue your search for your career, thinking about what you want and what you don't want is really important. And that's really a personal decision for you, trying to figure out, which things are kind of a necessity and which things are a want, and then discussing those things with your significant others or families is important. So just different topics to consider, like location, what type of clinical environment you want, if you want to be focused more on education or research or private setting, things like that. So specifically, like within that, like when you're looking at your clinical population or your day-to-day workflow, if you want to, mainly focus on your primary focus of residency or training and or sports or only sports, if you want to do that in an academic setting, if you want to be in a city or more rurally or suburban, if you want that tied with a sports team in particular or a school, and then what type of characteristics are you looking for in your group culture, your work environment, and then the people that you work with also. Outside of those types of things, targeting your salary and what type of benefits would be important to you and your family is also important. And these are things that probably change over time based on your experience and whatever else goes on with your personal life and things like that. Again, like talking about like which of these things are really important and which are more wants and less important, because you're not going to find the perfect job that meets every description or every want that you have. So which things are you willing to negotiate with and maybe settle for, and then other things that are a little more important. I think it's also important to kind of look at what you have control over. So when you look at a job description or you begin your job, it's definitely going to be different than what you anticipate, even, with residency and medical school, and probably things in your personal life. You never really end up at where you think you're going to be, and it never is quite the experience that you anticipated. So being able to identify like what you have control over is helpful when you come up with a conflict, or when you find yourself to be less happy or in a situation that you didn't quite expect to be the way it was. So things that you might have control over, or maybe who you work with, like if you have certain staff in your office, or if you're able to hire support staff or MAs or administrative assistances, what type of scheduling um, appointments you have, how many days of clinic you may have, things like that. And then like how you actually like work within those systems, like if you with your electronic medical record and different programs that we use throughout the day. There can be a lot of variation with how many clinics you have a week or how many patients you see in a day, how frequently you see patients. So if you're on like a 15-minute schedule or 20-minute schedule, or some physicians will see patients 30 minutes. If you have different days allotted for like procedures, or days allotted for training room, or, if you're just mainly clinically based. And then also if you're going to maintain work in your primary residency focus. So if you're in pediatrics or family medicine or internal medicine, are you rounding in the hospital? How often do you see those types of patients or work within that division? For those that are ER trained, how many days are you in the ER? How many shifts? How many hours? Do you want that hospital to be in the same system as where you see your sports patients, or do you want it at a different geographic location? Like, how does that make sense to you in your life? And so I think at this point, I don't think any of you have had a primary like attending rotation or attending position that most of you have just gone through residency and fellowship. So this job search should be different for you than it has been in the past. This is more of an equal playing field where you're really evaluating again, like personally, what do you want in your career? What's important to you? How do you want to structure your position? And so when you're evaluating opportunities and talking to different people, it's much different than it has been previously when you were going through the match for residency and fellowship. Um, so, just navigating a new playing field is also kind of uh, hard at the novice stage, I think. And then again, also just kind of keeping in mind that it's not going to be perfect. You're not going to have every single desire met. If you do at the beginning, I guarantee you, you will not along the way. And so it's okay to change jobs. It's okay to, find things that you're not happy with and try to negotiate for a different position. You don't have to live with whatever decision you made initially, and you should expect yourself to. So one of the things that's important from like a psychologic perspective is having an exit strategy. So when you decide, that you are unhappy, or when you're looking at jobs, trying to identify like what you don't like is important, so that as more things build that you don't like, or other opportunities come your way, or that you hear about that might be more enticing to you, that you're able to navigate how you're going to end this current relationship to then start a new relationship at another place of employment or company or hospital system, things like that. So having an exit strategy is important so that you're able to devise a plan that makes sense to you, that still leaves you in good light and in good standing with your current employer or your current potential employer, as you're interviewing with different places, so that you're able to maintain those types of relationships in the event that they become another opportunity for you in the future. So you just want to avoid leaving on bad terms. Sports medicine is a pretty close-knit community, especially like within like pediatric sports medicine or ER sports medicine. People talk, and even like those who work like within like the NFL or the hockey leagues or things like that. So you want to make sure that you build a good reputation, that you maintain a good reputation, and that you're always working professionally and putting yourself in a good light, so that you don't have rumors that are spoken about, or people perceive you in a poor lighting. We'd also like to encourage you all to, talk to us or talk to other people that you feel that you identify as a mentor going through this, either the first time out of training or later in life is always challenging. It can be stressful. It can be exciting as well. But certainly talking to other people about, what they've been through, what things that they think are important, what do they not like about their positions, what things should you consider, just helps to give you a little bit of a different perspective so that you can put yourself in a good position to evaluate opportunities and make decisions that are helpful for you. So one of the first things to do, and hopefully you've been doing this along the way, is to organize your CV. There's different formats that are followed for academic positions versus private practice settings, and the organization of how you display your training, your credentialing, your licensure, your experiences with either sports coverage or academic endeavors is important, and should follow a specific template, be organized, make sure you edit, have it proofread, and edit again, just to make sure that it looks presentable and professional, and that there aren't, obviously like spelling errors and that type of thing, but also that it makes sense chronologically, so that people can understand what you've been through and what you're able to offer to your future hospital system. And then with that, you also want to make sure that you list references. Typically, that's not done in a professional CV. That's usually done separately, where either the recruiter or people that you may be interviewing with, or other people in administration will ask for references. And so, before you get to that point, you want to make sure that you're able to identify who would be a good reference for you, and talk to that person to verify that they also would like to serve as a reference for you. You want to make sure that you choose people who are going to say nice things about you, and that they're going to respond to these questions in a timely manner, so that communication can be offered to support you in your opportunities. Whether you work with a recruiter or you work, either on your own or with different networkings, I think has its benefits and detriments. And I think it's, kind of personal preference. Whenever you're working with a recruiter, a lot of times they won't exactly know what the job entails. And so trying to save your questions that are specific for the job to individuals who can answer those questions is important. Again, making sure that you're timely and that you're polite, and that you present yourself professionally at any level is important, because they are going to give some type of report to whomever is making decisions about continuing to either offer you an interview or have you back for another interview, or tell you that, they're going to go a different way. So just make sure that when you contact people, that you answer questions, whether you're, calling or emailing, or communicating on, some type of other platform, that you're timely and professional and polite. You can certainly ask about, like, the work culture environment, and benefits, and the vision of the company and what things they're looking for, but they might not be able to answer a lot of questions for you specifically with the job. There's different ways to go through networking. Like, there's recruiting agencies, and then there's also job searches that are listed on different sports medicine websites. So with AMSSM or AOSM or ACSM, there's also different online platforms that, like Doximity or LinkedIn, that you can contact and talk to people in that regard too. Hold on one second. Tracy's calling me. Okay. Um, okay, so then when you get ready for interviewing, you want to make sure that you, again, are ready for the day, that you dress professionally, that you're on time, that you're personable. If you're doing online interviews, I think we've talked a little bit about how, Zoom platforms and other things like that are a little different, rather than interviewing in person. And it has become pretty common to do remote interviews now. There's even, some people who'll talk about whether or not you should blur your background, or, if not, you want to make sure that your background is something that's professional and not distracting. You obviously can have something there to kind of, share your personality, but again, you want to be professional. A lot of people have first impressions that are hard to overcome. So making sure that you're organized and that you're on time and that you present yourself in the best light is important. Also, selling yourself, focusing on the specific education you've completed, what was important to you in that education, why you chose that educational pathway, what specifically you gained from the different experiences you've had, so that you can really highlight what you have to offer. Again, also practicing, just like you have edited your CV, you want to kind of edit your interviewing skills. So sit down with somebody, do some mock interviews, ask them, for constructive criticism. Try not to take it to heart, but, it is important to just review, like, how do you come across, and try to work on those types of things, so that you can make it to the next step of the interviewing process. And then I would also encourage you to evaluate your social media, your carbon footprint. You want to make sure that there's nothing out there that is going to be embarrassing, or prevent you from landing the position you're looking for. And then in that, you can also research who you're going to interview with. I think hospital systems, there's a lot to look at, just like the goals and aims of the hospital, but then also the individuals who work there. So, what have they specifically focused on? What are they hoping to do with expanding the program? What are their goals? Whether it's, geographically or certain age group or specific sports groups, and how does that either align or not align with your goals and ambitions as well. When you're getting ready to interview with people, looking up their CVs is encouraged so that you can talk to them specifically about what they're interested in. If you can at least like get people talking about themselves, they will come away from talking with you with much more positive thoughts than if you talk about yourself the whole time. So, there is some psychological component to this, that you're trying to sell yourself and put yourself in the best light, but you also want to, in some regard, just make the person that you're talking to feel good so that they have good feelings about you. So, obviously, looking at their CV and what they're interested in research is important professionally so that you can see if those interests align with your own. But also when you're interviewing, you want to encourage them to talk about themselves, just so that you're able to get through these hoops to the next step of the interview process. Again, reach out to your mentors or reach out, network with other people who've worked with the individuals that you're interviewing with or the companies that you're considering, to find out what their professional opinion or personal opinion is about um, either the people or the geographic location or the hospital system, just to kind of find out more as you go through the process. When you're looking specifically at benefits for your contract, this usually isn't something you talk about in the first interview, and it's usually more on like written communication or electronic communication, or like they may direct you to a specific website for like the larger hospital systems. But there should be information to talk about benefits like healthcare insurance, dental insurance, what type of retirement plan or 401 contributions made. Talking about malpractice coverage is important, because when you decide to leave a position, you may be responsible for covering your malpractice tail, and that's something else to consider. And then finding out, what other type of like personal benefits are there, how many days of vacation, if you have funds for CME, because you'll maintain CME once you're done with your fellowship training. And that does get expensive year to year, paying for your boards and your licensure. And then you want to make sure that you have days off to do those types of training sessions, and studying things, just so that you're able to maintain your licensure as well. A little bit more, personal, or just considering FMLA and short-term disability, finding out like when you would be eligible for those types of things is important, and what standard for either FMLA or short-term disability, in the event you need to use that or you plan to use that for family planning. Kind
Other
of getting
thing,
into the,
Mary,
uh-huh.
the other thing with the short-term disability and family planning is some places that time is not paid. So, finding out what's covered if you take parental leave versus what you have to use vacation for, and what's paid versus not paid, can be really important, because if you are going to take off 6 weeks and they only pay for a portion of it, that can obviously financially impact you. A lot of people prefer to take off more than 6 weeks, and then that can be a big detriment, especially if you end up in a system where you're productivity based. So finding that out, I think, is super important ahead of time so nobody's taken by surprise.
Yeah, and that can add up. So just, timing, like when you may take that time off is also important, specifically for, sports productivity. So kind of again, planning, making sure that you're taking that into account is good to think about. For day-to-day flow, again, like how many patients you're going to see in a day, how many clinics you're going to have in a day, what types of patients you want to see, what types of patients you don't want to see is important, and how do you network within your community to obtain those types of patient referrals. Whether or not you're doing injury clinic or concussion clinic or like procedural clinic, that's going to change your productivity. That's going to change like how people view you in the community so that they know, when to see you or when you're open for accepting patients. And then specifically like within sports medicine, are there certain topics that you're more focused on, with nutrition or endurance athletes or specific athletes or specific competition levels. Again, kind of thinking about how much of that is what you'd like to focus on, how much of that do you need to focus on because the community needs it and you need to market yourself as, somebody who can kind of stand out in these certain populations. I think outside of clinic, what are you doing outside of clinic? What are you, covering sports programs? Are you taking call? Are you educating learners? And how are you compensated for those things specifically? When you're billing, a lot of us are measured on our productivity. What you do outside of clinic, that can vary from place to place as to whether or not that's something you're either compensated for at a flat rate or you're somehow given a buffer that you're not required to meet a certain productivity level clinically because you're also contributing either in research or education or, with outreach programs and things like that. So there's a lot of variability from program to program on how compensation works. But specifically, you want to make sure that the work you're doing is somehow being credited so that you're not just volunteering your time, your energy, and essentially your finances, because whatever time you're doing outside of clinic typically is not then adding to your clinical productivity. But these are ways that you can, make your job be something that you're more interested in or something that you're less interested in. So again, just kind of evaluating different opportunities and how you want to curtail your practice specifically. I think we talked a little bit about scheduling and working with different clinical staff. I think, really evaluating who you have access to help support you in your clinical practice is important. There are certainly other people who can do a lot of the work that we do, who can either, scribe and or type your notes, or, if you have access to electronics, scribes or AI that can help you so that you're not doing more work outside of your clinical hours. Whether or not you have the ability to give input as to whom you'd like to help you or how many staff members you need to help support your clinical practice. Those are things to kind of think about and negotiate in your formulation of your contract. A lot of these individuals are those decisions are made by the business managers and hospital administration. So when you're talking with those people, asking how they set up the practices, what type of input do you have on hiring and firing and securing staff to help you be productive clinically and to help you to be able to step away from whatever your clinical responsibilities are so that you can engage in other responsibilities or interests as well. And then as technology changes, what type of access do you have to those different platforms and programs? Is it in-house? Is it, in the suite? Do you have like a radiology within the suite or ultrasound within every suite that you work at when you're signing your contract? If that's something that is important to you, bringing that up and that being something that you negotiate that want access to ultrasound, or you will only work in clinics that have radiology on site is something to consider as well.
That ultrasound component's really crucial, like Cody, got signed up this last year to run an orthopedic urgent care, and they literally brought him in with the plan of having him essentially be like their ultrasound guy. And then they hired him, and there was no ultrasound in the clinics where they placed him. And he actually had to like really fight to get ultrasound, and it became a little bit of a battle. So you can think there's going to be one there. They can tell you that you're getting hired to do their ultrasound, but you need to probably write it into your contracts that, whatever ultrasound machine you want with the attachments that you need in order to do what you want to do will be present in the clinic locations where you'll be working. Because if you're working somewhere and then they say expand into a new clinic and they move you, and they're unwilling to buy an ultrasound machine for that location, that's a problem because it's going to affect your productivity. So it's a very expensive investment on their part, and that's something you want to make sure that you have, even if it seems like, oh yeah, why would I not have an ultrasound machine? They told me they're bringing me in as like their ultrasound person. So it's something I tend to tell people to get in writing.
Yeah, and I would say, the more you can get in writing, the better, because, that's something that you can reference later when either you're measured for some type of evaluation or you're looking to change your location or your clinics or, just different ways that your career may change. Having things in writing is important so that as other decisions are made or as other people are brought in, you're able to reference whatever information you were told previously, because anything verbal won't stand up when you try to argue for it later. So again, just kind of talking about compensation, trying to understand how compensation is determined at your position, whether that is tied to your academic rank or solely by how many patients you see or your geographic location or the types of referrals that you generate. And then if there is compensation for things that you do outside of seeing patients is important. There's quite the gamut from place to place. And so I do think it's important to just talk to people about how their structures are set up so that you're able to protect your time. This is certainly a business negotiation, and your employer will have you work as hard as you can and compensate you as little as possible just in order to keep their business afloat. I don't think that we are really focused on that business mindset when we go through training. And I think that in general, physicians are pretty naive about compensation and business negotiation. So the more that you can educate yourself, talk to other people, if you have contacts in the business world or you, are able to educate yourself just so that you're making decisions that help support you is, it's very important and it's going to, benefit you in the long run. Most compensation plans are weighted towards procedures. So when you're evaluating how are you able to meet certain markers of productivity, looking at how many procedures you can do or how much time can you allot for procedural skills will give you a little bit more of a productivity attainment than only seeing patients, day in, day out. And then knowing like how are those markers monitored, how are bills submitted, who reviews them, when are you, what's your timeline for being evaluated as to whether or not you've met those productivity markers. And if you surpass whatever marker you're supposed to meet, how are you compensated for that? So these are, just things to kind of think about, like not only in your initial steps, but then also as you maintain or consider, changing your job in any way. You just, again, want to make sure that you're being compensated fairly and for the work that you're doing. And if you're not, learning how to say no in a respectful way or learning how to navigate that conversation so that you are not putting yourself in on the path that you're not going to be compensated fairly. It's just kind of, something to kind of keep in mind. Um, Usually, I would say that these types of decisions happen with your like your direct clinical supervisor. So if that's like a division chief or the office manager or another physician who's in a more of a superior role or senior role, that's usually the person that you would talk with about what type of like clinical structure, compensation structure, and procedure structure you're looking for, and how you're evaluated, and what type of timeline you're reviewed on. um, Knowing how that person operates is important, so that again you're able to talk with them in a way that's respectful, but also obtaining honest information in a proper timeline. So just again, having things in writing and making sure that you're obtaining the information within a time frame that is applicable for you to be able to make decisions is important. Um, Thinking about referrals, so as you finish your sports medicine training, you'll graduate and be essentially at the same training attainment as your colleagues, but your training is different from other people. And so looking at specifically like what do you have to offer to a population? Like how are you different from other people? What things are you interested in? Um, that's important at the step of obtaining a job, but then when you are then practicing, reaching out to your referral base, whether that's acute care centers or urgent cares, ERs, private practice, or primary practice individuals, or other specialists, how do you market yourself so that people are selecting to send patients to you over somebody else is something to think about. Other ways to do that is, not only by like email or electronic announcements, but also at meet and greets, conferences that we go to, outreach programs. Just realizing that each of those types of interactions is a referral base, and selling yourself or highlighting your strengths is important so that you're able to maintain your presence and build on what your services you offer to your community. Different things to evaluate. Some people are interested in academics and education, whether you want to educate learners or work with specific education groups, or more, generalized with hospital education. What role do you want to try to follow, and how do you navigate that path? How do you find mentors within those contexts so that you can develop your presence in that regard as well? Um, let's see. Oh, and then also like your clinical colleagues when you're working with different specialists, building on those working relationships so that people feel like they can refer patients to you, but then also you can refer patients back to them, or ask questions when you have patients that are maybe a little more concerning, or you have questions about, or you're thinking about a different way, just to build relationships so that you can have communication pathways with either general physicians, specialists, orthopedic surgeons, also with the ER and urgent care physicians as well, and then our athletic trainers and physicians extenders. Your community outreach programs are also good for referencing or referrals. And that can be ways that you build your presence in the community. You can also develop research programs with those outreach programs, and focus on special populations to help build your presence and kind of find your niche as to what you're interested in. Things are a little bit more outside of clinical practice. You can look at how you can develop your presence with your employer or with the hospital system, like being on committees in your hospital, being on committees in a regional setting or a national setting. That also helps to build not only your network so that you get to know other people and other people recognize you, but it also develops your service, that you become more educated in certain committees that are either looking at like quality improvement, education, outreach, different things like that. And so pursuing different opportunities will help you not only to figure out what you're interested in if you don't know, but then also help you realize what you don't want to do as you get to know other people and develop your career for the future. Stepping back further from your practice and your career, looking at the community is also important. So, you know, whether you want to live in a certain region of the country or be close to family, or you have an interest, you know, in other geographic locations, you know, trying to find the community that you're interested in and the type of community you don't want to live in is important. If you have specific goals for further education or you have children looking at the schools in that area, and then how those schools can also be a referral base for you is something else to consider. And then just, you know, looking at weather, climate, entertainment, things like that in the community. And then with that, like talking with your significant other about what they're, or your family about what they're invested in as well. We talked a little bit before about having an exit strategy. So as you talk to different recruiters or physicians or answer emails or kind of put your name out to look at different programs, you're definitely going to identify places that you don't want to pursue along the way as well. So understanding how to communicate that in a respectful manner is important at each stage. So whether that's during the initial search period or after you've had a couple interviews, or even, you know, after you've been working at a place for a, you know, number of years, learning how to say no and how to step away from that relationship is important. When you are entering into you know, finding a job, there's a letter of intent that you can write. This is a little more formal than a lot of the emails that are sent, or just like calling people, but your letter of intent also has a specific format similar to the CV that you you know, introduce yourself and kind of talk about your training, and then you talk about why that particular place is important to you, and then you may reference you know, whom they could contact in the event that they want to reach out to you, or they first want to reach out to a reference before they contact you. So we can talk with you all a little bit more later about letter of intent or send formats for that as well. Contract negotiation, I think, again, is outside of like these types of topics, but either talking with a contract lawyer or someone else in the business world about like what specific topics you can negotiate, what things are going to be kind of more set in your contract. And then I think, you know, how you're evaluated on those types of things. So again, talking with your mentors or talking with us, or, you know, other people that are also searching or that recently secured a position, how did they negotiate their contract? What things should you make sure are written in your contract? Like Sue's brought up, like the ultrasound, if you're being recruited as an ultrasound physician, or, you know, how many clinics you're going to have a week, or, you know, what type of patient population you're going to work with, like whatever it is that you are focused on or hoping to achieve, you know, how much of that should you have in your contract, and then how are you going to be evaluated in meeting those types of benchmarks. Most places will have a salary guarantee for the initial 2-year period. That should be spelled out in your contract. If you don't meet, you know, a certain productivity marker, you typically are still kind of guaranteed that salary initially, and then after whatever time frame is stated, if you don't meet your productivity after that point, there's usually some type of renegotiation that needs to occur. But again, knowing that those words are in your contract specifically, so that when you're signing, you know what you're agreeing to. And then other things that are worth considering your tail is when you leave your place of employment or you break your contract, you usually need to give notice within a certain time frame. Then that should be written in your contract, and then you may have some type of financial tail that you have to pay so that your malpractice insurance is covered. That's typically something that's negotiable, as is your non-compete clause. Your non-compete clause is typically a set number of months or years that you agree not to set up practice or not see patients within a certain geographic region that is in proximity to the place where you're working. And that is that's something to consider, because that's essentially either ties you or eliminates you from certain pools or geographic locations for maintaining your practice. So talking with a third party is important so that they can evaluate, what is fair in your contract, what's not fair, or what leads you at least to be less marketable, so that, again, you know what terms you're signing. You can do this formally with a contract lawyer. You can do it informally with, mentors and having other people look over your contract. I think a lot of that's kind of up to you, but the more that you educate yourself, the better position you put yourself in for understanding what you're signing. Specifically, when you're preparing for your interview day, you want to make sure that you present yourself in the best light. You want to dress professionally, be respectful, make sure that you've practiced some of the topics that you're going to talk about, but you don't want to sound rehearsed. Specifically, there's some things here about how you should dress and what you should not wear or, be distracting, that type of thing. And then if your significant other is invited to the interview, you want to talk with them about what their role is before you go to your interview day. A lot of times the first interview does not involve your significant other, but then a subsequent interview may involve your significant other. Whether or not they attend, sometimes can be kind of judged by the group as to whether or not you're truly invested or interested in the position. And so, whether or not you invite your significant other is something to also kind of talk about. However, you want to make sure that they understand that their whole role is just to support you. They're not really to share their opinion about anything. You want for them to leave that engagement just as your significant other is your cheerleader. And then if you all have either differing opinions or are not on the same you're not at the same step at making a decision, that's something for you to talk about later, away from the interview day. Usually they go, and even if sometimes if they're, a professional or a physician, they may meet with a different department in if they also are interviewing in the same place. But usually their role is just to be there to look at the community, like work with the realtor, see what is available, in the district from either like schools or restaurants or entertainment or that type of thing. And then I just provided like a list of questions for you all to kind of go through to rehearse or consider practice, so that you think about things that you should ask and things that you should be able to answer. Some of these are just conversation starters or points to kind of build from, just so that you're thinking about things as you go through this process.
Mary, I was trying to shuffle children out the door, so I missed a little bit. Did you discuss at all the fact that usually compensation's not honestly discussed a lot of times at the first interview?
So we talked about that a little bit at the beginning. We did talk about like some of the things to think about with compensation. Usually you don't bring that up at your first interview. It might be something you talk about at your second interview, but you want to make sure that you have those questions answered before you sign anything, for sure.
Yeah, it seems to pretty much be brought up at that second meeting most of the time. Or if it's not brought up at the meeting, like following the meeting, they send you that info. If they're interested in moving forward with you, for sure.
Did you all have other questions?
You tell them we're
Okay.
switching over compensation models here.
Um, we didn't talk about the other, so, we were just told, oh, within the past month that we're rolling out a new compensation plan. And so we talked a little bit about how things change when you're within your career. Again, like knowing that compensation plans can change once you're already employed and once you're already, engaged in your position. Um, that can be something that is within your control in some regards, but a lot of it is out of your control. So, our compensation plan here is changing from something that used to be based on your academic rank to now being more productivity based. There's still a lot of gray with their rollout. So they're rolling it out in stages so that next year there's a set compensation marker, and then after that it's going to be more productivity based. So in that, like, we are currently identifying like who do we talk about with understanding the compensation plan that we are now going to be following. What types of things are we going to have control over? How are we going to change our clinical structures? Who do we have in clinic that can help us to be more productive, that type of thing. So, a lot of these topics we currently are addressing as a division within pediatric sports medicine to better understand the compensation plan that's coming out.
I think this is my fourth or fifth compensation model since I started here.
So I think overall, like, I just really think it's important that when you all are looking for a position or that when you're working within a group, that you have people that you feel like you can talk to about what you're experiencing and whether you're working at a fair rate and that you're being compensated justly, but then also that like you're being able to see the patients that you want to see, that you're feeling like you're making a contribution in the manner in which you are hoping to. And then if you aren't, how do you find another position that allows you to pursue the goals that you have? I think understanding that whatever position you end up in, it's not going to be what you thought it was. Identifying what you have control over and what you don't is important. And then also evaluating what other options are out there, so that you have a little bit better identification of how your position compares to other options that may be available. I think it just keeps you happier overall. And just also it helps you to kind of learn the process as you go along.
This is more of a detailed question, but are RVUs affected by like what support staff you have? So like if you have a casting tech, for example, do you make less RVUs because you're not the actual one casting, or is it just the fact that you're ordering the cast that you get the same level of RVUs?
So some of that can be determined by your compensation structure, but typically staff is salaried. Physicians or providers are tied to productivity. So there's different productivity benchmarks for physician extenders and different compensation models for physicians as to whether or not they receive credit for the physician extender who works with them. So, like a cast tech or an athletic trainer or a nurse is going to be salaried, but they do make you more productive in your clinic. If you work with a physician's assistant or a nurse practitioner, they may contribute to your productivity depending on your contract. Did that answer your question, Heather?
Yes, thank you.
Okay. But certainly the more things that you do that are not in direct patient care are going to decrease your productivity. and whether or not that, is something that you make decisions on so that you are seeing more patients, or that you make decisions to support how long you spend with patients, or if it's more important for you to, be able to form the relationships that you have, or to be, more productive clinically. I think it's a balance that everyone tries to find and maintain and argue for. Anyone else have any other questions?
Is team coverage usually something that's like outlined in the contract, or is it just more of like kind of understood when you get hired by a group?
So anything that is not outlined in your contract should be. So if you are expecting to have, or you're expected to have one night or one team, or, one community event that you cover in a certain time frame, or if you're compensated for any of that, that should be in your contract. If it isn't, it's okay to ask that it is put in your contract. And there can be parameters, that it's going to change, but I would just encourage you to ask for everything to be in writing. Because as your company signs, to offer more services, those services are going to fall to you unless you have it explicitly stated that this is what you're required to do. I think you can also talk with, the physicians that cover other professional teams, and ask how those relationships are formed, what type of either compensation agreement or contract they have outside of the hospital with those teams as well. Any other questions?
And we're happy to look through like cover letters and CVs and stuff like that. We always need a little bit of time. So, and harass us. So if you send it to us and we don't respond, send it again, bother us by text message. Sometimes, we just get buried with email. So sometimes we know you need it done, but it gets lost in the shuffle. So we're always happy to look through stuff, or do like mock interview things. I also tell people before you go interview, if they send you a schedule ahead of time, look up the people who you're going to be interviewing with and know a little bit about them, because it can be a good conversation starting piece. So if you know who you're meeting with and what their interests are and what they do, then it kind of gives you a whole nother bank of questions you can pull from, especially if you have somebody who's more challenging to talk with.
And then I think the other thing to also just note is that letter of an intent that typically binds you more than you think it does. So before you sign a letter of intent, that's usually the first like 2-page contract that comes out before the billion-page contract. So before you sign your letter of intent, make sure you have your questions answered. And it's okay to ask questions and to clarify so that you know exactly what you're getting yourself into.
And sometimes for big hospital systems, there's very little that you can negotiate. So a lot of times it's just very generalized, like, as listed in the physician manual, and they'll leave it just, whatever the issue is, CME determined by academic rank, and then as outlined in physician manual. So just make sure, like, if they're referring to stuff like that you're getting a copy of whatever document they're referring to, because that usually gives the hospital the ability to make changes at their own discretion that you have very little control over, which is very common.
Hey guys, thanks for joining us this morning. Let us know how your search is going and reach out as you make progress or don't make progress along the way. We're here to help you along.
Make sure you guys take time. Like things tend to slow down a little bit in the new year when deductibles reset. So it's like a good time to start thinking about what kind of job you're looking for, getting a cover letter going, getting your CV polished so that you can just start adding to it as you go. And then really starting to watch the job boards or posting your information in different places. But really, January, a lot of places have their budgets determined for the year. And if they're going to be hiring, they're really oftentimes posting in January, February. So you want to be ready to hit the ground running and have your paperwork ready to submit. So think about over the next couple weeks trying to take time to do that. Thanks, Mary.
Hey guys,
Thank you.
have a good one.